Hello, welcome to Holistically Speaking. I am Morella DeVoe, your host. Our mission with Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most. And today we're talking about IBS, irritable bowel syndrome. And my guest today is Dr. Mike Stadtmauer, who is a naturopath and functional medicine practitioner. Is that correct?
That's correct.
Right? Okay. I'm delighted to have you on the show again. We've done a couple other shows. But this is a topic we talked about, I think, from the very first show, that we wanted to dedicate a show to irritable bowel syndrome because it just seems to be like a growing trend. Like more and more people are talking about it. A lot of people maybe don't know what it is, could have it, or so we just want to share information, not just about what IBS might be, but also what people can do about it, how you particularly work with IBS. So let's help our viewers just kind of wrap their heads around what is irritable bowel syndrome. How would you describe what we call irritable bowel syndrome?
Yeah. So there is, in the end, a medical definition for irritable bowel, which I don't think is that important. Ultimately, it's some kind of dysfunction of the gut, and there's many different things that, many different ways it can present. So it can be bloating, it can be loose stool diarrhea, it could be constipation, it could be cramping, it can be pain, it can be a mix of all of those things. One of the main points is that there's a lack of pathology. So kind of the definition of irritable bowel syndrome is that it's classified as a functional bowel disorder, which is to say that there is no real pathology going on. So you do this test and everything is normal, but you still have these symptoms, and then you're told, okay, you have irritable bowel.
So pathology means there's no bug or specific that causes it, or?
Well, pathology, I guess in the more classical sense, there's no major inflammatory process, there's no destruction of tissue, there's no real disease process happening.
So a functional condition like this means that the function is just not right.
Yeah, right. That there's no disease, but at the same time, there's abnormal function.
Gotcha. So why do people get IBS, or how does this come about?
So there's a number of different factors that can influence somebody having IBS, somebody having a bowel and intestinal system that's not working normally. So there's normally four things that I'll consider when I'm talking with somebody and kind of going through their case.
And we have a slide for this, I believe, right? Oh, there it is.
Yeah. So we can think about what's called secretory issues, or is the gut working properly? Are you making acid? Are you making enzymes? Things like that. We'll talk about that in a second.
Yeah.
And then food intolerance, the influence of food on the system. And then kind of what's growing within the bowels. We have a huge amount of bacteria, literally pounds and pounds of bacteria that live in our guts.
Yeah.
And if the mix there is off, or if it's in the wrong place, a lot of things can go wrong, then that can cause these symptoms also.
And that's what we call dysbiosis?
Yeah, so dysbiosis is just a fancy word for an imbalance between good and bad things living in your gut.
Gotcha. And then you're also going to tell us a little bit about SIBO.
So SIBO stands for small intestinal bacterial overgrowth.
Okay.
And it's, just as it implies, an overgrowth of bacteria within the small intestine where it's really not supposed to be.
Gotcha. So can we take each one of these apart a little bit? Can you tell us a little bit more about what do you mean by secretory issues?
Right. So the first question I think that we have to ask, which sometimes doesn't get asked, is the gut working properly? So there's a number of different, we have the stomach, and we have the small intestine, we have the large intestine, and food moves through. And at each point, there are things that are supposed to happen in order for you to have proper gut function.
Right.
So somebody can be not producing enough hydrochloric acid in their stomach, and then that results in, it can result in bloating, it can result in constipation, it can result in absorption issues. It can also result in not killing bacteria that you swallow that come in through your mouth, and that bacteria then moving into the intestinal tract where it causes a problem. So this can be either an issue where the person is not producing enough hydrochloric acid for many different reasons, or because they're taking a drug that does not allow them to produce hydrochloric acid.
I was just going to say, I don't want to take us off topic, but with this growing trend of taking not just antacid, but acid blockers, really heavy drugs that block the stomach production of acid, do you see that contributing to an increase in irritable bowel, IBS?
Yeah, absolutely. I mean, it's a known cause of the SIBO issue, the small intestinal bacterial overgrowth issue. Yeah, because you're shutting off that acid, which is, again, our first line of defense.
Right.
And we get inundated daily. We don't like to think about it, but we swallow all kinds of things that, that come into our bodies. And most of that is killed in the stomach, where it's supposed to be.
Right. So the secretory issues is the first possible influence on someone developing IBS. So then...
Yeah, so then beyond just hydrochloric acid, then there's the pancreas, which is supposed to produce enzymes. And again, there could be many different things going on. The pancreas tends to be impacted by other stuff going on in the GI tract. So if there's some kind of inflammatory process going on within the small bowel because of reactions to foods or reactions to organisms, then oftentimes we'll see very low pancreatic enzyme activity. And so the pancreas isn't producing enough enzymes, and the person can't break down their food properly. And again, we can see bloating, we can see constipation, these kinds of issues. And then moving further on, there's the gallbladder. And the gallbladder's job is to squeeze out bile, and bile helps us to digest fat. And so if the person isn't digesting fat properly, then maybe they can't tolerate this or that food, or they have, again, those same issues of bloating or what have you, and maybe they have too much fat showing up in their stool.
Right. Fat, or doesn't it also, fat that isn't digested, doesn't it also lead to like runny stool, where it's people...
It can. It can lead to kind of greasy stool, and or a floating stool.
Okay. And oh, I lost my train of thought. Oh, just kind of going back to the when you were talking about the pancreatic enzymes, and the enzymes being needed to break down food and all of that. I once read that a congested liver can, I don't want to guess too complicated, but that a congested liver can make the role of the enzyme, or lead to pancreatitis, or complicate the role of the pancreas. So things like alcohol or sugar that tend to be liver congesting can. Am I complicating things too much, or is this connected?
Well, the liver and the pancreas aren't exactly connected. Ultimately, they kind of feed into this same tube that empties into the small bowel.
Okay, so they're not as connected as...
Not so much. I mean, I think the same things that would influence the liver would also influence the pancreas, though.
Gotcha. So we have digestive juices in the stomach, the pancreas, the gallbladder. Are there any other secretory issues?
Those are the main things that we think about, and there's ways of assessing those things. So we can do various testing to see if the person's producing enough hydrochloric acid if we need to, or sometimes it could be just done through a clinical picture. I will also say that reflux, which is normally thought of as this high acid issue, is actually, in my experience, more often caused by a lack of stomach acid and low stomach acid, because there's a sphincter that doesn't get closed properly when there's not enough acid. And so many times we can take care of reflux by actually giving the person acid to take. And then things tend to work better.
And it sounds really counterintuitive, because a person is experiencing heartburn, and they think, I need to plug down that acid, take antacids to quelch it, and actually it's the opposite. Exactly. So then what about food intolerances? How is this contributing to the IBS?
Food intolerance, in my experience, and in general in the naturopathic approach to things, plays a central role in really most chronic disease, but especially issues of the GI tract. In gastroenterology today, in kind of standard gastroenterology, food is really not thought to play a role in GI disease, GI function, but in reality, we see very different things. And so we can respond to food in a number of different ways. And most of the time when we think about food issues, people think about the case where you eat a peanut, you have to go to the hospital,
right.
that kind of thing. And that's a significant allergic attack, and it's called anaphylaxis. And it's mediated by a pathway of the immune system called an IgE pathway. But there's two other main pathways that the immune system uses to respond to allergens. It's called an IgG and an IgA pathway. And these two pathways will never lead to that anaphylactic type of response. They cause much more kind of insidious sort of background responses. Sometimes it is an immediate response. Sometimes it takes 2 days for some kind of manifestation to occur.
And what do some of those responses or manifestations look like or feel like?
So it can be very widely varied. It can be constipation or diarrhea or bloating, certainly, but it can also be things like headache and sinus issues and eczema and asthma and reflux.
Right.
And sometimes it even is things a little bit more ambiguous, like foggy thinking, just fatigue, just kind of feeling malaise, those kinds of things.
So what's really kind of interesting or challenging about that is that someone might be having recurring headaches and just feeling generally tired, maybe drinking coffee every day because they're constantly fatigued and just not really feeling great and energized, and thinking that this is just who they are, popping, pain killers, and then they have these tummy troubles that they think might be completely disconnected, but then they're totally connected.
Absolutely, yeah. I think last time I was here we talked about how the #1 symptom of people with gluten issues is fatigue. Not any kind of stomach issue.
Right.
So yeah, we can absolutely see all of these things coming directly from these food intolerance, food sensitivity, food allergy. I don't think it really matters what word we use, but these kinds of reactions.
So people, in order to find out whether they have a food sensitivity, is it always through testing, or can you, decide to be a really good detective?
So I often say there is no better test than your own body. There's no better test than a trial and error kind of test where you take a food out and you see how you do, and you put it back in and you see how you do. We call that an elimination challenge.
Right.
And that's often very informative.
Right.
Sometimes though, there's various things that can go wrong with that kind of testing, and so sometimes we want to do some more objective testing, and sometimes people just want to see in black and white, oh, I can't eat that food because this test is high or whatever.
Right.
So there's testing that we can do through the hospital system, there's testing we can do outside of the hospital system that will look at these IgG, IgA reactions. So
then shifting into the bacteria imbalance, the dysbiosis and SIBO. How do people get to the place of having bacteria imbalance?
So like I said earlier, there's literally, and if you think about it, this is an enormous amount of bacteria. We have pounds and pounds of bacteria that live in our gut, millions and millions and millions of bacteria.
It's hard to grasp that you could weigh the bacteria. Yeah.
It is, but they're there, or at least they should be. And there's all kinds of things that can go wrong. A single dose of antibiotics can decimate a good bacteria colony. And it's supposed to come back by itself, but sometimes it doesn't for whatever reason. And that can throw the person off for decades.
Right.
A high sugar diet is one that favors things like yeast and other bacteria that maybe we don't want so much of.
Right.
And so that can throw things off. Different imbalances, taking a PPI, an antacid type of pill, can throw things off enough to create a real imbalance.
Oh, right, because you're saying now the bacteria that would die in the stomach environment are now getting down all into the intestine, and so that's probably tipping the scales in the wrong direction.
Absolutely, absolutely. Yeah.
Gotcha.
So yeast overgrowth is something that I certainly deal a lot with. Again, not a concept that's fully embraced by the allopathic community, but one that we deal with all the time.
Right. And yeast also shows itself in a multitude of ways, right?
Sure, so this is another issue that can have very global symptoms.
Right.
Very often people feel fatigue, people feel very foggy in their thinking. It can, again, lead to skin issues. It can lead to other kinds of allergy type symptoms.
Right. And so you see yeast often connected with IBS? Or
Sometimes.
Yeah.
Sometimes it's the lone cause. Sometimes, and that's another thing about IBS, is that there doesn't have to be one single factor.
Gotcha.
You know, the person can have issues with how they're secreting things, which then allow for yeast overgrowth. And so you have kind of issues on top of issues that develop.
Right. So it's leading me to think where there can be all of these different influences or causing factors where each person is going to be uniquely different, that then each approach to working with an individual is going to be different. You don't have one formula.
There's no formula. No,
Gotcha.
no, there's no cookie cutter approach. You have to take each individual as an individual and understand their case and their history and their family history and all of that in order to really understand how to best help them.
Yeah.
And because of this, you know, there really is no drug that can treat all IBS cases. There's certain drugs for constipation cases, and they have issues associated with them. But the medical industry has a real hard time dealing with this because there is no single cause.
Right. Right, and then in the traditional way of testing treatments in medicine is taking a group, giving everybody the same pill, and if everybody does better, then, you know, that's typically how they sanction this treatment works.
Right.
But if everybody's individual, then it's not going to work the same way for everybody, right?
Yeah, absolutely not. Yeah.
So can you walk us through a little bit of how you typically tend to approach some of these issues that we lump under the IBS umbrella? And then maybe we can talk about how you evaluate, you know, find out whether someone actually has it. But
Yeah, so in terms of them having IBS, you know, that's just done basically through symptoms. If they have these recurring symptoms, if they have just a one-off, you know, symptom, or they've never had loose stool before, and all of a sudden they have loose stool, it's probably not IBS.
Right.
It's probably, you know, they got infected with something, or they ate something, whatever the case. So they have to have this issue recurring over time. And then if that's the case, then really I find the most important tool is not any laboratory tool, but a really good history.
yeah,
Understanding their symptoms, understanding the timing of their symptoms. Does it happen typically after meals? Does it happen before meals? Does it happen during meals? Does it happen at night, in the middle of the night? Does it never wake them up from sleep? These are important questions.
so your evaluation process isn't so much test-based, but really lots of questions.
Well, that's how we start.
Yeah,
And then
okay.
those questions will lead me to think, oh, okay, well, I think this is more likely involved, or that's more likely involved. I think foods maybe is a big issue here because you've had these issues from day one, and you probably haven't had a yeast infection from day one, or something like that.
Right.
And so I'll recommend that, okay, let's start with some food testing, and then we'll talk about the options there. Or if I think that, well, it sounds like there might be some kind of organism imbalance because you have this really heavy antibiotic history and you crave sugar all the time and all that kind of stuff, then I'll say, okay, well, maybe we need to evaluate that. And we do that through stool analysis.
Gotcha.
Using this great company that's a out-of-network lab, and they do DNA-based stool analysis, and so we learn all about what's living in the person's GI tract.
Right. So can you give us an example of where the timing of when a particular symptom arises might tell you different things?
So the best example of this is probably the SIBO issue, the small intestinal bacterial overgrowth issue. And what we expect to see is that approximately 30 minutes or so, or within 30 minutes after a meal, which can start pretty immediately, but within 30 minutes, the person is experiencing very significant, kind of painful, uncomfortable bloating, sometimes with nausea, sometimes not. sometimes with real pain, sometimes not. And that is a very typical kind of symptom of SIBO that would lead us down that road.
And so bloating that shows up hours later would be something different? Or?
Most likely it would be something different. Most likely then that's being caused by something happening within the large intestine.
Gotcha.
Or sometimes we can see people with what are called motility issues, where they're not moving food through properly, and so maybe that symptom hours later is happening, you know, up top where it shouldn't be, but that's what's happening. So
Gotcha.
you gotta, you know, just stay wary of that. But yeah, typically we can differentiate it by that.
So then once you've gone through the questionnaire, the assessment, and maybe stool samples and all of that, and you say, okay, this person has a few factors that would put them under the IBS category, how do you go about it?
Well, of course, it's highly dependent on what we're dealing with. And the goal is always to correct the issue.
Right.
So that if they're not making enough hydrochloric acid, okay, why is that? The cells that make hydrochloric acid are actually the most energy demanding cells of the body. They demand more energy than the heart, the brain, anything.
Wow.
Because it takes such a huge amount of energy to concentrate acid, to take blood, and from blood make hydrochloric acid. It's an enormous, what's called concentration gradient that has to be, ionic gradient that has to be overcome. And so if there's any energy deficiencies in the body, if they have thyroid issues, if they have adrenal issues, if they have, you know, other things that aren't allowing them to produce energy correctly, then they're not going to make acid.
Wow, I had no idea.
Yeah.
Excellent.
You know, if their pancreas isn't working properly, then there's things that we can do to try to get that back into shape. There's all kinds of things we can do for the gallbladder, herbal approaches mostly, to rehab a gallbladder. If we need to kill yeast, if we need to kill bacteria, then we can do that through prescription agents. We can do that through herbal agents, depending on what we're dealing with. So it's just a matter of of doing a good evaluation, doing some good testing to figure out exactly what you're dealing with, and then treating it appropriately. In almost all cases, that's going to involve some kind of dietary change as well. I think that's absolutely key in many cases to a good outcome.
Right.
And so the person has to be open to that as well.
Well, and I can imagine some viewers maybe hearing that and saying, okay, what is the food that typically people with IBS need to eliminate? Is there one or two, or is it also highly individual?
It's super individual. You know, we come across a lot of gluten issues, of course. It's all the rage. And a lot of dairy problems, certainly. If the person has a combination of constipation and sinus issues that are relatively lifelong, that's in 99% of the cases a dairy issue. But it can be anything. It can be nightshades, you know, the tomatoes and eggplants and such. It could be nuts. It could be citrus. It could be all kinds of different foods. Soy is another big one.
And so how do you go about identifying which it is?
So the person, so again, they have a choice. They can either do an elimination diet if they're rigorous enough to do that, or there's these food panels that we can run where they test for anywhere, depending on the panel, from 15 to 100 different foods all at once to see if you're having those IgG or IgA reactions that I said earlier.
Oh, interesting. So how is, and I don't know how a traditional GI doctor would approach IBS. So is the functional medicine approach to IBS different than what a gastro doctor would do?
Well, so normally what, I think it is quite different because there's an approach. Normally, the person, if they go with these kinds of symptoms, will have a pretty decent workup to rule out any of the pathologies. And in many cases, all of that testing is negative. And so if all that testing is negative, then there's really nothing to treat.
Right, there's no medicine.
Right, you know, from that perspective.
Because it's not Crohn's, it's not...
Right, it's not this, it's not that. You have IBS.
Right.
And they're typically not given any dietary advice even. And again, there really are no drugs except in some very specific cases. And those drugs have a lot of side effects. So the functional approach, I think, is really the only approach,
Right.
Because we're actually taking a look at what's causing these symptoms and trying to correct the problem.
Right, so the bacteria imbalance, the food sensitivities,
All
and
of
all
that.
of that.
Mm-hmm.
Do you have any stories of someone whose life was just transformed?
Well, a lot. I mean, this is something that I, deal with every day, and I certainly have people that can't believe how much changed for them with some very simple changes. Probably the dairy issue, especially in Vermont here. We love our dairy in Vermont, as we should, but it's not good for everybody.
Right.
And so just today, I saw a dairy farmer who I had to tell they needed to stop eating dairy.
Oh my gosh, that's heartbreaking.
Yeah, they took it very well, and they're up for it. But that can make just such a tremendous difference. Somebody who their entire life they had one bowel movement a week, and all of a sudden they're having regular bowel movements, and they're no longer bloated every day, and they no longer have their headaches, and just by stopping that one food.
Which actually, what you just said brings to mind, the definition of what's normal. Because the idea, some people think that one bowel movement a week is normal.
Right.
That this is just who they are. I know a friend of the family who's constantly bloated, and it's the joke because this is who she is. She just thinks that being bloated is the way to be. So what is normal?
So we can say that normal is, as humans, we're actually engineered to have a bowel movement after every meal. Most people don't do that, mostly because we're not eating enough fiber to do that.
Right.
But we should be having at least one well-formed bowel movement a day. And normally I describe it as kind of a peeled ripe banana.
Okay.
That your stool should be somewhat similar to that.
Yeah.
And normally it's not going to float. Although if you're eating a lot of fiber, it can. And there should be a lack of bloating, there should be a lack of cramping, there should be a lack of pain, there should be a lack of discomfort, a lack of heartburn, all of those things.
That's quite a shift, because I think that, people are used to the idea that gas is just a normal part of digestion. And so the idea that digestion should just be smooth is quite novel.
Yeah.
So we're actually just almost about to run out of time, and I want to be sure to have our viewers know how to contact you, because you've shared a lot of really valuable information. So if we can show how to reach Dr. Mike, there's, there we go, at vermontfunctionalmedicine.com, or also at naturopathicvermont.com. As you can see, you can certainly, I'm sure you heard, there are many things that might be going on for you that you need help with, and Dr. Mike can help to determine what might be going on.
Try my best.
Yes. So thank you so much for shedding so much light on this really big umbrella. I didn't realize that it was so big. I hope you learned as much as I did today, and feel free to email us or reach out to Dr. Mike to get a consultation.
Absolutely.
Thank you for joining us. See you next time.